if somebody is being traumatized, they feel their life is threatened, and the brain has very, very quick responses which don't go to the cortex, the thinking part of your brain. Not got time for that. You respond instantaneously to the threat. And when you revisit that experience, it still doesn't go to the cortex. There are certainly fibres that go from a wee part of the brain called the amygdala, which is the one that really controls that. Well, it's got memories in the amygdala as well, but that is the one that sort of orchestrates the response to threat, instantaneous response to threat. When you revisit these memories, you feel exactly the same because the cortex isn't really getting involved in that memory, because there's actually memory in the amygdala as well. And you're immediately feeling that I'm there again. So that people can have flashbacks because one small part of that memory has intruded on their consciousness. And it can be something as simple as a smell, BO or whiskey, or these are common ones that clients of mine experience, but you can get other ones, visual ones, auditory ones. I had one recently where I was clicking a pen and somebody actually had been threatened with petrol and a lighter. And the clicking of the pen had been enough to get her really quite upset, because we were actually treating her at the time, and I'd made marks in her skin and I was clicking the pen. So things in the environment that other people would think are quite innocuous can be triggers for flashbacks or for going back to memories, and they're not going to be mediated by, that means they're not going to be controlled by the thinking part of your brain. This is all in the limbic system, the primitive part of your brain, that this goes on.